So this is a USAID-funded project to look at One Health workforce capacity building. And so I'm going to provide the why for this project, but the following speakers are following me are going to provide the how. First of all, I want to really recognize the strong partnership with our Tufts partner in this process. So this could not have been done without the collective input of a number of universities as well as our U.S. partners in this. And so the title of my talk is Building an Ebola-Ready Workforce, a One Health Workforce Overview. So let me begin. First is just a reminder of the multisectoral threats that are arising and our need to really be prepared. We've heard already about the issue of the ongoing Ebola outbreak and basically the public health emergency now in DRC. The increasing spread of antimicrobial resistance, especially multi-drug resistant organisms, not only in our hospital settings, but also in the environment as well as our food, as well as in our agricultural systems. And then especially the ongoing spread of African swine fever and its impact, even though it's an animal-only disease, its impact on humans in the loss of food security, in the loss of income, and also in a sense, the mental health aspects that go with that. And so universities are really a catalyst for change. We heard a little bit of that today. And so I'm going to talk a little bit about some of the initiatives that we've been doing and really focused on the last 5 years. And so as a reminder about this particular project, our mission was really to improve workforce capacity in targeted countries to prevent, detect, and respond to threats posed by infectious diseases and zoonoses, and that includes antimicrobial resistance. And our audiences are threefold. They're first focused on students, and so those students that many of us in this room are teaching. The second is that group of individuals that were probably our former students that are now in the workforce. Those in-service professionals, retooling them or tooling them to respond to a number of the Ebola-related type of issues that they might face. And then lastly, the faculty and the institutions and how we actually reach and engage them as part of the process. So in a sense, we need a new kind of worker, a One Health workforce worker. And so how does that person look? And so clearly that individual has to have the technical competence, be it a physician, a dentist, a nurse, a veterinarian. They also have to have a collaborative engagement. So one of the things that we've had the privilege of doing is facilitating the bringing together of the disciplines to understand what those disciplines do and how we could best serve them in that regard. As part of that, we need an enabling environment that requires basically a supportive system that actually allows for, facilitates that bringing together of those sectors and facilitating that conversation. So one of the issues is to take a step back and say, what are some of those key factors associated with successful collaborations? And so one of our colleagues at the University of Minnesota basically did a very extensive literature review to try to summarize what those factors are. What are those key factors? And basically, she was able to identify individual factors, organizational factors, and multisectoral network factors. And so if we dive down in those a little bit, for individual factors, it really gets down to our education and training, our prior experiences and relationships, and then also the, you would prefer me to use this one? You want me to use both? Okay. Organizationally, those include organizational structures and culture, human resources, as well as communication. From a multisectoral network factor, includes a multisectoral network structures, those relationships, those leadership skills that we want, or having adequate leadership skills and training, and also the management to be able to work in those collaborative structures. Also looking at the available resources that go with it, but also involves the political structures that will help facilitate those ongoing discussions. So to work towards that One Health workforce transformation, the particular project that we've been working on focuses on 3 areas. How do we engage multisectorally? How does universities coordinate with multisectoral ministries and communities to kind of identify those One Health workforce needs? That education and training to improve workforce capacity to prevent, detect, and respond to emerging disease threats. And then also the institutional strengthening, where we strengthen not only the university, but also the network capacity to be able to sustainably address those workforce training needs. So as a result of that, there were 2 networks that were set up. And so obviously here in Africa, the One Health Central and East Africa Association, or OHW, or the One Health Central and East Africa Network, which is really a combination of work in 8 countries with expansion and engagement in their surrounding countries. And we've heard a lot about their work, and I won't dive into that, and I'll let my follow-up speakers actually talk and address those. And also, and actually this is a dated slide as I look at this, the SIUHUN network, or the Southeast Asia One Health University Network, which initially involved Indonesia, Malaysia, Thailand, and Vietnam, but now has expanded to Cambodia and Laos as of 2 weeks ago. So again, breaking this down into a summary of some of the activities that have happened. Initially, there was a multi-sectoral engagement, and if we look at what we've done up to this point, we're actually in our 5th year. There have been 11 national workforce assessments that have been done in countries. Those are involving multi-sectoral engagement and approaches. There have been 18 outbreak investigations, many of these largely done in Africa, and basically involving multiple sectors, and for our universities being part of that engagement. Also, there have been 167 community outreach activities, again, across multiple sectors, multiple disciplines in dealing with that. And I think that our follow-up speakers will provide you more detail about how that has happened. I'm going to take a little bit of the thunder away from our OHW context. This was actually a timeline that our OHW partners put together that focused in on outbreak responses for students and student engagement, outbreak responses for graduate students. And so this is over time. The lead partners involved in those, so many of them involved the Ministry of Health, the Centers for Disease Control, the FETP programs, and involved outbreaks like the Rift Valley fever outbreak, yellow fever outbreak, an aflatoxin outbreak, again, where students are involved as part of the response teams. And also our graduate students also involved in the Marburg outbreak, Rift Valley fever outbreaks across Uganda, as well as other countries as well. So highlighting the value of the universities partnering with a number of ministry partners. The second piece is that education and training, and again, summarizing and looking at year 1 to 5 achievements, and actually we're still in year 5, so these numbers are a little bit fluid, but there were 55 One Health student clubs that were established, so clearly a number of students that are involved. 42 One Health field visits, so this is actually field experience opportunities. The placement of 85 One Health fellows, nearly 12,000 students that have been trained, especially in One Health concepts, and also over 4,000 current health professionals that have been trained. So really has touched a number of individuals through training and outreach opportunities. As an example, this is actually a picture from our Thailand colleagues who are basically supporting the training of village health volunteers to really promote community health approaches, especially One Health community approaches. So that's an example of basically this in-service training that is offered for community health workers. And then lastly, institutional strengthening. Looking back again at that 1 to 5 years, that nearly 4,000 faculty have attended One Health professional development events. It may be as simple as training in grant writing and how to garner sustainable grants, especially with a One Health focus. Supporting the development of 28 academic and professional training programs. Some of those are One Health focused, wildlife focused, or environmental health focused. Looking at the One Health University Network membership consisting of 9 government agencies. So again, getting that multisectoral engagement across 162 schools, 84 universities in 12 countries, representing human, animal, environment, and multiple other disciplines as well. To give you an example of that, I single out our Ethiopian colleagues who I think just a few months ago actually helped create an institutional review board for animal research that actually helps support their university infrastructure there. So my hat's off to them for that work. So in summary, I want to just conclude with a couple of reflection or summary comments that I see, especially with this particular project. One is the broad student engagement and excitement. I think we'll see that on Friday with the case competitions. Our students are amazing, and just to really observe them in that regard. And we've seen that through the transformation of students that have been through the process and now, are becoming our One Health leaders for the next generation. We've also seen the development of these university networks and their engagement of government partners. They've created new educational materials. Ashea in particular has a number of modules that they've created that they make readily available to anybody. It's on their website and can be easily downloaded. There's also a move in our networks to sustainability, to broader engagement of other potential funding partners to support their efforts. Also, there's an innovative and responsive effort to a number of the emerging issues, as I already highlighted, with outbreaks response to and government engagement to Ebola, to influenza, to anthrax, to rabies prevention efforts. Also, we've been breaking down a number of the academic silos. So institutions or disciplines that haven't talked to one another actually are sitting in the same room. And that's even true in our own U.S. institutions. So we can actually, I think we are learning from you in many respects in that regard. Also, we're using more active learning techniques to actually better engage and help our students retain the knowledge. And this is being done through tabletop exercises, through problem-based learning activities, as well as simulation exercises. And so, and this has been largely done through more south-to-south collaborations versus actually bringing U.S. or European partners to help in those efforts. And with that, I'll turn it back over to the moderator.